Intermountain Healthcare researcher receives national grant to identify genetic markers of lung disorder. And joining us today is Dr. Mark Dodson from the CTEF program at Intermountain Healthcare to talk about what this really means for the disorder. So for people who don't know, what is CTEF?
So CTEF is a mouthful. It stands for chronic thromboembolic pulmonary hypertension.
I'm glad you're saying it.
It's a complicated name, but it actually makes sense. So pulmonary hypertension refers to high blood pressure in the arteries in the lungs. And chronic thromboembolic means that high blood pressure is from blood clots that don't go away.
So there are blood clots in the lungs that don't go away from blood thinners, and people sometimes mistake it for other diseases, right?
Yeah, so blood clots in the lungs are quite common. About 1 in 1,000 people a year is diagnosed with a blood clot in the lungs. Only about 3% of those people go on to develop CTEF. So in the majority of people, they're treated with blood thinners and the clots go away. CTEF is hard to diagnose because the symptoms are very nonspecific. Usually patients are short of breath, but it's pretty common to be short of breath after having a blood clot, and that can last for some amount of time. And so you have to have a high index of suspicion to catch this disorder.
So the message here is if you have those symptoms, look a little further. It might be something else besides what you're thinking. It could be this rare condition.
Yes. Yeah. CTEF is commonly misdiagnosed for other more common diseases like asthma or COPD, and there is a pretty standard diagnostic test that's very sensitive at ruling it out.
And recently you guys started doing these surgeries to remove this intricate problem of taking these blood clots out of the lungs because you were sending people to San Diego.
That's correct. Yeah, it's a very specialized surgery. It's an open heart cardiac surgery. And even most cardiac surgeons, even though that's a very specialized field, are not trained to do this surgery. So we had traditionally sent our patients to San Diego, which is a big national referral center for this disease. But through a couple of years of work with several physicians and nurses at Intermountain Medical Center, we're now able to offer the procedure here in Utah.
And now with your expertise here right in Murray, you have this grant to research even more. What is the significance of this?
Yeah, so we don't understand why people develop CTEF. What we'd really like to know are if there are markers in the blood that we can check when someone has a pulmonary embolism, a blood clot in the lungs, to figure out who's at risk for developing CTEF. And we're interested in whether there's gene mutations that might predict who's going to develop the disease. So using the Utah Population Database, which is a big genealogy database that was initially maintained by the LDS Church, we've identified a number of families in Utah that have an excess number of these cases of CTEF. And the grant allows us to do gene sequencing on the CTEF patients from these families to find the common mutation that they share, which may be causing the disease.
Intermountain Healthcare is known to look in the genealogy and finding so much more. What is your hope of finding maybe there is a link, your hope in research?
My hope is that we can find a way to predict who's going to develop this disease so that we can identify those patients up front and prevent them from ever getting it.
Okay, excellent. Thank you so much, Dr. Dodson. With Intermountain Healthcare CTEF program, if you would like to know more information about this condition and more about the research, go to intermountainhealthcare.org. We'll have a link on abc4.com.